Welcome dear students. In this video of granulomatous diseases, let us see the other bacterial granulomatous diseases. We have already studied about Rhinoscleroma in the previous one. In this video first, let us look at tuberculosis of the nose. Now TB of nose per se is quite rare, and in that also we have primary and secondary tuberculosis. If at all it occurs, it is usually the secondary type of tuberculosis. Primary tuberculosis of nose is, I can say, very rare. What you find are usually secondary tuberculosis. Primary is either in the lung or some other place, and in the nose we find secondary tuberculosis. So what is tuberculosis? It is a chronic inflammatory condition of the nasal cavity caused by Mycobacterium tuberculosis. Mycobacterium tuberculosis is the causative organism. It is an acid-fast bacillus. Now looking at the pathology of tuberculosis, it affects the septum, and that too the cartilaginous part of the septum. Cartilaginous septum is involved. Now there are 4 stages in the tuberculosis of nose, and they are: the first stage is catarrhal stage. In catarrhal stage, there is inflammation of the mucosa. So what you see is congestion. Congestion due to inflammation of mucosa. After the catarrhal stage, the next stage is the nodular stage. In the nodular stage, we find swellings that are present. These swellings later on form granulomas. So what are granulomas? They are tumor-like swellings, and these are seen in the septum. So they are bilaterally visible. The septum is swollen bilaterally. And as a feature of tuberculosis, upon the swelling we find caseative necrosis. Caseation is found. Next, coming to the third stage. Now before that, please look at pictures of these 2 stages. This is the catarrhal stage, where you can see congestion and inflammation in the anterior part of the nose. And this is the nodular stage. Can you appreciate the nodule, the swelling? Okay. Next, let us move on to the third stage, that is the stage of ulceration. The nodules of the previous stage will eventually rupture and lead to formation of ulcers. Nodules rupture and give rise to ulcers. And this can also cause perforation. Rupture can also cause perforation, and this will lead to perforations of the nasal septum. Perforation of septum. And the last stage is the stage of cicatrization. This is characterized by formation of fibrous tissue, and it leads to stenosis and adhesions. Stenosis and adhesions are the classical features of cicatrization. Scar formation is seen. So these are the 4 stages of tuberculosis of the nose. Coming to the histopathology, the classical features of tuberculosis are seen. What are they? There are giant cells called as Langerhans giant cells. Epithelioid cells, modified macrophages. And there is caseative type of necrosis. Central caseation is seen. Acid-fast bacilli can be seen. Taking a biopsy will confirm the diagnosis. Next, let us look into the clinical features. If we look at the symptoms, the first symptom is the nasal discharge. There is serosanguinous type of nasal discharge. In some stage of the disease, even a blood-stained nasal discharge is possible. Next, there is nasal obstruction. Why is there obstruction? Because of the swellings, because of nodule formation, and also because of crusting. These will lead to nasal obstruction. Nodules and crusts. And pain is present in the ulcerative stage. Generally, tuberculosis is a painless condition anywhere in the body except TB larynx. But here pain is seen in the ulcerative stage. Why is there pain in ulcerative stage? Because of exposure of the nerve endings. Those free nerve endings will cause pain. And upon examination, what are the signs that you will see? You can observe the nodules, the stenosis, adhesions, and also the swelling, depending upon the stage of the disease. So how are the nodules? You can see them as bright red thickening at the septum. What are these? These are the nodules. An ulcer could be present or could be absent depending upon the stage. And you can also see adhesions and stenosis. Now let us move on to the diagnosis of this disease. Now the clinical features that I have discussed are specific to the nose. The features of primary tuberculosis could also be present, such as weight loss, evening rise of temperature, the general weakness of the patient. All these could be present. Now coming to the diagnosis. First, an attempt should be made to find out the primary. And for that, you have to take an X-ray of the lung, X-ray of lungs, chest X-ray. Do tests such as Montauk's test, ESR, you can take a swab and examine it, send it for culture and sensitivity. All these things can be done. And for the nose, a biopsy specimen is useful. We can appreciate the histopathological features and identify it to be tuberculosis. What is the treatment? Anti-tubercular treatment for a minimum period of 6 months. At least for 6 months. If at all cicatrization has occurred and there is stenosis, compromise of the structure of nose, then a nasal reconstruction surgery can be planned. After complete resolution of tuberculosis, then we can plan a nasal reconstruction surgery. This will improve the airway of the patient, plus also it has a cosmetic appeal. Okay, so this is about tuberculosis of the nose. Now let us look at another small point, that is lupus vulgaris. What is lupus vulgaris? It is tuberculosis of the skin. And here we are talking about tuberculosis of the skin of the nose and upper lip in that area. It is a low-grade TB that is sometimes seen in this area. And what is the most important feature? Presence of apple jelly nodules. These apple jelly nodules are the characteristic feature of tuberculosis of the skin, lupus vulgaris. They are brown gelatinous nodules that are present in that area. Okay. So after tuberculosis and lupus vulgaris, let us now move on to another granulomatous disease, and that is leprosy. Leprosy is another chronic granulomatous infection caused by bacteria known as Mycobacterium leprae. It affects the peripheral nerves, skin and mucous membranes of the respiratory tract. Okay. It affects peripheral nerves, skin and mucous membranes. Leprosy is common in tropical and subtropical countries where the climate is warm and wet. The mode of transmission is direct human-to-human contact. It spreads by droplet infection. Droplet infection. Reduced cell immunity results in multiplication of the bacteria. And also, the inflammatory reaction called as lepra reaction is the one that damages the nerves. Now, let us look at the stages of this disease. Here also, like any other granulomatous disease, we have 4 stages. And the first stage is called as catarrhal stage. This catarrhal stage is associated with coryza, common cold. What happens is, when the mucous membranes are raw, due to hand picking, the disease spreads from the rest of the body into the nose. And the features that we find are, there is profuse nasal discharge, serous or mucoid, and along with that there is nose block, sneezing and running nose. Okay. So in catarrhal stage, there is profuse nasal discharge, sneezing and nasal obstruction. Now this is the most infective stage where the disease can spread from one person to another person. The second stage after catarrhal stage is the nodular stage. In the nodular stage, we find nodular thickening of the septum. Now it's interesting to note that the time gap between the catarrhal stage and the nodular stage is a lot. It could take as much as 10 years for the patient to express nodules. Okay. And then after the nodular stage, we have the ulcerative stage. In the ulcerative stage, the nodules rupture and give rise to ulcer formation. After the rupture of nodules, we find ulcer formation, and there could be perforation of the nasal septum. So there is a rupture of nodules and perforation of nasal septum. This leads to complete destruction of the skeletal framework of the nose, and all the deformities are seen. Now in the ulcerative stage, the nasal discharge could be blood stained. The nasal discharge here could be blood stained. And also there is nasal obstruction because of the granulomas and also crusting that has occurred. Please look at this picture showing the deformity. This is how the nose would become. When the septum is destroyed, later on it can give rise to saddle nose type of deformity. Okay. Now let us look into the next stage, the last stage, that is cicatricial stage. In the cicatricial stage, there is fibrosis. Fibrosis occurs, and like any other disease, it leads to stenosis and adhesions formation. There is stenosis of the vestibule and adhesions are seen everywhere, further worsening the condition. The clinical features you have already seen in various stages. Now let us look into the diagnosis of this. Taking a biopsy specimen from the nose helps, and you can see histopathological features specific to leprosy, such as all the bacilli arranged in parallel bundles. And there is vascular infiltration. All the features of leprosy are present. Treatment is anti-leprosy treatment. A combination of dapsone, clofazimine and rifampicin is used. Anti-leprosy treatment. And if at all the structure of the nose is disturbed, we can do a nasal reconstruction surgery after the disease process has resolved. With this, I complete leprosy also, and we have just one more condition in bacterial granulomatous diseases, and that is syphilis. Syphilis is a spirochetal infection. It is caused by Treponema pallidum. Spirochetal infection caused by Treponema pallidum. Now, syphilis can manifest either as congenital syphilis or acquired syphilis. Let us first look at congenital syphilis. In congenital syphilis, we have two stages, the early stage and the late stage. In the early form, which is usually seen in the first 3 months of life, we will find the most important nasal feature is snuffles. Snuffles, that is that characteristic nasal cry of the baby. Snuffles are seen, and you can identify it as syphilis because of the other stigmata that are present, such as corneal opacities, Hutchinson's teeth, frontal bossing, saddle nose deformity, and all these features could be present. So together all of them will give you a clue that it is congenital syphilis. And then we have the late form that presents at the time of puberty. Here the characteristic and important feature is gumma formation. Okay, it is present in the septum and it destroys the bony part of the septum, leading to saddle nose deformity. The bony septum is affected and that leads to saddle nose deformity. So let us now look at the acquired syphilis. This is about congenital syphilis. The two features, one is snuffles in the early stage and then gumma formation in the late stage. In the acquired type of syphilis, we have 3 stages. The first stage is the primary stage. The primary stage manifests with a chancre. What is a chancre? It is a hard, non-painful, non-ulcerative mass, papule, called as chancre. Now, chancre in the nose or vestibule is very rare. Okay, the chancre disappears by itself, and then after a few years, we get into the second stage of the disease. In the second stage, the chancre disappears by itself, and after 6 to 10 weeks, we get into the second stage of the disease. Now, this second stage is the most infective stage, and one has to be careful while examining the patient. There will be rhinitis. The patient presents with simple catarrhal rhinitis. there is nasal discharge. Along with that, there is fissuring of the nose. Fissuring and crusting of the nose is present. Fissuring and crusting are seen at the nasal vestibule. And also there is a mucocutaneous patch. Non-pruritic maculopapular eruptions are also seen. Now in the second stage also, there are multiple manifestations, and in the nose all that we find is nasal discharge and rhinitis-like features. The third stage is the most important, the tertiary stage. In the tertiary stage, this is the stage usually where the nose is involved. And how is it involved? By the formation of a characteristic structure called as gumma. Gummas are formed in the nasal septum in the tertiary stage of syphilis. So gumma is seen in the nasal septum, mostly the bony part. Syphilis affects the bony part. Tuberculosis and leprosy affected the cartilaginous part first. Syphilis affects the bony part, and eventually there is destruction of the entire bony septum and nasal deformities. Now let us look into the clinical features, the symptoms and signs. So the patient presents with pain in the nose and headache. Now this headache is worst at night. It aggravates in the night time. Plus there is nasal discharge, offensive nasal discharge. And also there is bleeding and crusting. These are the symptoms. What are the signs? Upon examination, you will see that there is a swelling affecting the bony part of the septum. Swelling of bony septum. Sometimes by the time the patient presents to you, perforation of septum might have also occurred. Perforation of septum. And the most characteristic feature, that is gumma. How does a gumma present? It appears as an ulcer with wash leather floor. An ulcer with wash leather floor is an important feature of syphilis, gumma formation. Along with this, you will see scarring and crust formation. And saddle nose deformity could be present if the septum is already destroyed. So these are the clinical manifestations of syphilis of the nose. After clinical features, let us look into the diagnosis. The bacteria has to be isolated by performing serological tests such as VDRL. And there are many tests for syphilis, certain specific tests and certain screening tests. They have to be done. And also taking a biopsy from the specimen will also help. You can see the causative organism, that is Treponema pallidum. On a dark background microscopy, you can see Treponema pallidum. Next, let us look into the treatment of syphilis. It is by benzathine penicillin. Penicillin injections have to be given. 2.4 million unit injections, 3 doses. This is the treatment for syphilis. And also to take care of the nose, you can give nasal alkaline douches, and also removal of the nasal crusts helps. Okay, and if perforation of the septum and saddle nose deformity has occurred, then removing of all the sequestrated tissue along with the nasal reconstruction surgery is recommended after resolution of the disease. So this is about syphilis, and with this I complete all the bacterial granulomatous diseases. So let me quickly revise all of them for you. First is tuberculosis. What are the important points? It is usually the secondary type of tuberculosis that occurs in the nose. Primary is very, very rare. Even secondary is rare for that matter, but it sometimes occurs, okay? So it affects the cartilaginous part of septum, and what are the four stages? First is the catarrhal stage, and then we have the nodular stage and ulcerative stage, and finally the cicatricial stage. Okay, and histopathology shows Langerhans type of giant cells, caseative necrosis, and acid-fast bacilli. What are the clinical features? A serosanguinous nasal discharge, nasal obstruction because of the swelling and crusting, and also pain is seen only in the ulcerative stage. Signs are a bright red thickening at the septum, that is, nodules can be observed, and ulcer and perforation could or could not be present, and you will also see adhesions and stenosis if it is the cicatricial stage. Okay, you have to diagnose the primary tuberculosis, and also for secondary tuberculosis diagnosis a biopsy specimen is taken. It is anti-tubercular treatment, okay, and nasal reconstruction surgery. What is lupus vulgaris? It is tuberculosis of the skin of the nose and upper lip. And the most important feature is apple jelly nodules. Next, let us move on to leprosy. It is caused by Mycobacterium leprae. It affects the peripheral skin, nerves and mucous membranes. It spreads by droplet infection. What are the stages? Again, the same four stages: catarrhal stage, nodular stage, ulcerative stage and cicatricial stage. Then diagnosis is by biopsy and treatment is anti-leprosy treatment. Next, in syphilis, we have two types: congenital syphilis and acquired syphilis. It is a treponemal infection caused by, it is a spirochetal infection caused by Treponema pallidum. In congenital syphilis, early form and late form. In early form, we have snuffles, and in late form, gumma formation. Acquired syphilis again has three stages. In the primary stage, there is the chancre. In the secondary stage, there is simple catarrhal rhinitis, but this is the most infective stage, so you have to be careful during infective So you have to be careful during ENT examination. The third stage is the most important stage. This is the stage where the nose is usually involved as formation of a gumma. Okay, and what are the clinical features? Pain and headache, nasal discharge, bleeding and crusting. And upon examination, you will find swelling of the bony septum. Perforation of septum along with saddle nose deformity could be seen, and gumma, that is an ulcer with wash leather floor, is important feature. Okay, scarring and crust formation could also be observed. And how do you diagnose? Syphilis specific tests like VDRL, and also taking a biopsy of the specimen shows Treponema pallidum organisms. And what is the treatment? Benzathine penicillin. We have also learnt about rhinoscleroma in the previous video. Let us learn about other granulomatous diseases in the next video. Thank you very much.